So a lot of patients' journey in our office begins with a phone call. And although sometimes that might be with a receptionist, more often it'll be with our scheduler or our patient care coordinators. And they will get into a conversation with you about what are you looking for? What procedure are you interested in? Getting some basic information, getting some information about the procedure, about the surgeon that they're going to be seeing, and sometimes even a little heads up as to the costs involved in some of these procedures, just so people aren't surprised. And then they'll get a consultation date. They'll show up at the office, and of course, the first person you see then would be the reception team. And we have a couple of receptionists behind the desk, and they'll warmly greet you to the office and likely have a little bit of paperwork for you guys to fill out unless you've done that online. And it's always great when patients do that online before coming to the office. And then one of our medical assistants will greet you. They'll meet you in the reception area and escort you to an exam room and get some more information. And then I'll come in and say hi and ask what brings you to see us today and who sent you. And then we'll get into a nice conversation about what you're looking for, what your goals are. And many times I don't ask them what procedure they want. I'll ask, what are your goals? What are you looking to achieve? And then we can talk about procedures that will help you achieve those goals. By the time you've met me, you've already likely had a conversation with a patient scheduler and the receptionist and the medical assistant, maybe one of the nurses. Then you'll get to see me. And if we've talked about a surgery and you're requesting a quote, a price quote for what that costs, then you will face-to-face meet our patient care coordinators, and they'll go over a price quote with you. And from there, it's up to the patient to decide if they want to book surgery and how to go from there. I usually take clinical photography at the end of the first consultation. It's not a requirement by any means, but by that point, most patients know what procedure they're thinking about, and we've come up with a plan, and therefore it makes sense to get the photographs done so we don't have to worry about getting that at the preoperative visit.